Given the complexity of this bill, I'd invite you to take a look at our brief to better understand our position. My comments today will be of a more general nature, however.
Public health objectives related to reducing the harm related to cigarette consumption, and most critically, preventing youth from smoking, not even a tobacco company. Kids should not smoke, period. There are known health risks associated with smoking, and cigarettes should only be consumed by adults that have made an informed decision knowing all the risks. This is why Imperial Tobacco Canada supports reasonable and evidence-based regulation, especially the ones aimed at keeping tobacco products out of the hands of Canadian youth. However, we oppose regulation that will not achieve any of the stated health objectives, and particularly those that will be counterproductive. We also believe reduced harm nicotine products can play an important role by encouraging adult smokers who switch to alternative sources of nicotine with potentially lower health risks. Therefore, we welcome Bill S5's intent to legalize vaping products across Canada. This bill is a good first step in that direction, but it is incomplete without a proper regulatory framework. Following the enactment, Health Canada's #1 priority should be to introduce vaping regulations promptly to ensure that the health of consumers is not compromised by poorly manufactured and potentially dangerous products. In addition, the bill's provisions that limit manufacturers and retailers from communicating to consumers are problematic. Restricting promotion of these products, of these reduced harm products, will make it harder for adult consumers to understand the potential benefit of switching. In our submission, we suggest reasonable amendments to these restrictive provisions. If public health is the ultimate goal, those amendments need to be incorporated. Moving on, we strongly oppose those provisions of the bill that seek to standardize not only tobacco packaging, but even cigarettes themselves. We have a number of reasons for doing so. First, these measures violate our trademark rights. As a business involved in the sale of a legal product, we have the fundamental right to use our trademarks. Second, packaging and product standardization will make it impossible for consumers, retailers, and even law enforcement officials to distinguish a legal product from an illegal one. Canada already faces a huge contraband problem, with parts of Ontario now seeing more than 50% of the market made up of illicit tobacco. According to the RCMP, there are over 50 illegal cigarette factories in Canada, with enough collective capacity to take over the supply of the entire Canadian market. There are hundreds of organized crime groups dealing illegal tobacco, and these groups collect and pay no taxes and flaunt tobacco control laws. They sell cigarettes at a fraction of the legal price and have no qualms about selling their products to underage Canadians. If these measures pass, it will provide a template for organized crime groups to flood the Canadian market with contraband and counterfeit products. Some say that Canada is immune to an increase in illicit trade because of graphic health warnings and excise stamps on legal products. As you will see in our submission, warning labels and excise stamps already appear on illegal products, including, incredibly, baggies of cigarettes. Our third reason for opposing plain packaging is that it simply doesn't work. The only country that this policy has been fully in place for a long period of time is Australia. Despite what some groups will tell you, the truth is that according to the data from the Australian government's National Drug Strategy Household Survey, there has been no acceleration in the smoking rate decline in that country since it introduced plain packaging. Smoking incidents in Australia, like in Canada, was already declining year on year, and that trend did not accelerate after plain packaging. In Canada, tobacco packages already have graphic health warnings that cover 75% of the package surface. They are hidden from public view at display at retail, and there is no evidence that has been offered that the remaining branded area of the pack impacts a person's decision to start smoking. But Health Canada wants to go even further and standardize the appearance of cigarettes themselves inside the pack, suggesting that a tiny trademark or a marking on a cigarette is somehow an inducement to smoking. Quite rightly, other countries have rejected Health Canada's efforts to impose cigarette standardization based on appearance through the World Health Organization's Framework Convention on Tobacco Control citing lack of evidence. Based on a study from the Canadian Lung Association, 70% of youth who smoke say they started because their friends smoke or they felt the pressure to start smoking. None of them said it was because there was a logo at the bottom of the pack or a trademark on the cigarette. The best way to prevent youth smoking and reduce tobacco consumption is through proper education and awareness campaigns targeted at vulnerable populations. This is the approach taken by the United States where, without any of the extreme measures introduced in Canada and Australia, the smoking rates has declined to similar record low levels. To conclude, I cannot finish without noting this government's contradictions when dealing with tobacco versus marijuana. The government has said that it plans to legalize marijuana because prohibition doesn't work, because legalization will protect youth, and because disruption should be taken out of the hands of criminal organizations. In contrast, senators should ask themselves whether packaging and product standardization of tobacco is really the #1 priority to protect the health of Canadian youth,